Growing criticism over its pause in vaccine delivery for 2 days over the Christmas holiday. Many doctors stress that time is critical in rolling out the vaccine in Canada. And according to a leading scientific journal out of the UK, Canada is falling drastically behind other nations in getting people vaccinated. According to their data, Israel has been able to vaccinate more than 4 people for every 100 citizens, whereas Canada has only given the shot to 0.14 people per 100. And we also sit well below Bahrain, the UK, and the United States. For more, I want to bring in infectious disease specialist Dr. Isaac Bogoch. He joins me from Toronto. Dr. Bogoch, good to see you. But can you explain why our vaccine rate is lower than some of these other countries?
I think we have to be careful interpreting that data because most countries in the world don't actually have vaccines rolling out right now. And those countries that were listed are basically the only countries that are vaccinating individuals. So in Canada, we're one of the very few countries that actually have vaccine programs rolling out. Having said that, the European Union is starting to roll out vaccines yesterday and today, but still the vast majority of countries do not have vaccine programs. So certainly there's room to improve in Canada. Certainly we should be rolling these vaccines out the moment we get them. And certainly we should really be scaling up our vaccine efforts. But when we look at which vaccines we have and the vaccine programs that we have, we're still miles ahead of the rest of the world. Will that be maintained? I don't know. We'll see. I certainly hope so. But, very few countries on the planet have actually rolled out programs so far.
Okay, I need to press you on this next question, though, because you are on the Ontario Task Force and you oversee the storage, delivery and distribution of vaccines across Ontario. Why would Ontario and other provinces halt vaccinations on Christmas Day and Boxing Day, Doctor? The virus knows no holidays or takes vacation.
Yeah, exactly. I think that's a very good point. And while we certainly saw a slowdown in the vaccination in Ontario and, of course, in some other parts of Canada, it didn't stop. Like there certainly was still some vaccine programs running. But I agree. I share that sentiment. I mean, we still have access to these vaccines, and the faster we get it into people's arms, the better. And as you point out, the virus takes no holidays, and neither should we. And I do share that sentiment, and that it would be ideal to really have these vaccine programs running at full tilt. If we have product in freezers, it's not good enough. We have to get that into people's arms.
You've been so wonderful in making yourself available and being very upfront and direct. And so I just want to ask you again, who was responsible for that decision, and why was it made? What was the rationale behind it?
That's a good point. I'm not entirely clear, and I don't want to speak out of turn, and I don't want to speak. I just don't want to contribute to any false information. It appears that at the very local level, there might have been some staffing concerns, but like you, I'm looking into this as well because I'd like to know more. Okay. But I don't actually know.
I do appreciate that. Thank you for answering that question. Let's talk about this new variant, though. 4 reports of it in Canada, but is there any doubt in your mind there's likely more than that? They just haven't been detected at this point.
Yeah, certainly that's the case. And this is the kind of thing when we think about these variants of COVID-19, you need to do what's called genomic analyses or genomic sequencing of the virus to detect them. And like anything else, wherever you look, you're going to find it. And if you're not finding this particular variant, you might find other variants that are also concerning. And globally, we're not doing enough sequencing. Certainly, some countries are leading the way. For example, the United Kingdom does a good job with this. Iceland and a few other countries are very good at sequencing a pretty significant proportion of their COVID-19 cases that they detect relative to other countries. But Canada certainly does this as well, and it's helpful. And I think we're going to see more of this here. The real question, though, is, how significant is this? Mm-hmm. Right? It perhaps is. We don't even know to what extent it's more easily transmitted. I think it's very important to be cautious here. It's certainly okay to take the safe approach, but I think it's not quite clear what the significance of this variant actually means just yet. But in the meantime, while those questions are being addressed, yeah, it's a good idea to be careful.
Yeah, maintain the protocol. Dr. Bogoch, as always, appreciate your time. Thank you so much.